How to recognize heart attack symptoms in women. Today, we're diving into something incredibly important for women's health: heart attacks. While heart disease is often associated with men, heart attacks are actually the leading cause of death for women in many parts of the world. But did you know that the symptoms of a heart attack in women can be very different from what you might expect? In this video, we'll talk about how to recognize the symptoms of a heart attack in women so you can take action if needed. Let's get started. What makes heart attacks in women different? First things first, heart attack symptoms in women can often be subtler than those in men. While men often experience the typical chest pain or tightness, women are more likely to experience atypical symptoms. This is why it's so important to know the signs. The sooner you recognize them, the sooner you can get the help you need. 1. Chest discomfort or pain. Let's start with the most common symptom: chest discomfort or pain. While chest pain is the classic sign of a heart attack, women may experience it differently. Instead of a sharp, crushing pain, it may feel like a tightness or pressure. It can also feel more like indigestion or a heaviness in the chest. Some women describe it as feeling like there's a weight on their chest, or as if they're having trouble breathing. If you feel any discomfort that doesn't go away, don't ignore it. 2. Unusual fatigue. Another symptom that's more common in women than in men is unusual fatigue. You might feel extremely tired, even after a good night's sleep. This fatigue can feel like a general weakness that doesn't improve, and it can last for days before the heart attack actually happens. It's one of those subtle signs that's easy to overlook, but it's important to pay attention to. 3. Shortness of breath. Shortness of breath is another symptom to watch for. Women may feel like they can't catch their breath, even when they're not doing anything strenuous. This can happen alongside or even before the chest pain. If you feel winded without reason or it's harder to breathe than usual, it's time to take it seriously. 4. Pain in the neck, jaw, or back. Pain doesn't always stay in the chest. For women, pain can radiate to the neck, jaw, back, arms, or even the stomach. The pain might not feel like a sharp stabbing pain, it could be more like a dull ache or a strange pressure. If you feel this pain without a clear cause, especially if it's combined with other symptoms, it's worth paying attention to. 5. Nausea and lightheadedness. Finally, nausea and lightheadedness are often overlooked signs of a heart attack in women. You might feel queasy, dizzy, or even faint, especially if these symptoms come on suddenly. If you suddenly feel lightheaded, weak, or like you might pass out, don't wait to see if it passes. This could be a warning sign. What to do if you recognize the symptoms? If you're experiencing any of these symptoms, especially chest discomfort, shortness of breath, or extreme fatigue, don't hesitate to act. Call 911 or your emergency number immediately. Heart attacks can happen quickly, and the faster you get medical help, the better your chances for a full recovery. Even if you're not sure, it's always better to be cautious.